Okay. So, the American Psychiatric Association says that individuals with serious mental illness have better treatment outcomes when a family member or support system is involved in their care, right? Attempting to contact and involve a family member should be the standard of care for mental health inpatients. This is what they say. Okay. Those are quotes that you can use if somebody is refusing to talk with you. All right. So, Slido here is I want to know how involved are you in the level of care of someone with SMI? So, if you don't mind participating again with your phone, I would appreciate that. And the answers are flying in, and we're seeing some of you are having your loved ones live with you and you're able to advocate as needed. That's terrific. Some are unable to advocate with their providers, which is not great. Some of you are guardians, which is also great. And then others are writing into the chat, and I appreciate that very much. Okay. If you desire more engagement in the care of your loved one, what's currently preventing you from doing that? His resistance, yep, that can definitely be a problem. Anosognosia, not an issue currently. That's terrific. Your adult child's rights and her resistance, pretrial incarceration. Yeah, that can make it really difficult. Lack of a release of information, compliance, legal situation. Yep. Lots of different barriers from letting us participate and engage. All right. Thank you all for participating in that and sharing. So, when we talk about care partners, we're talking about anybody in the patient's family of origin or family by choice. So, it could be parents, siblings, spouses, adult children, partners, significant others, even close friends are sometimes people that are actually good care partners. And, families are important allies, and the data backs that up. They did a study in New York where they found that most people with SMI caught in the system want their families involved. 92% of them wanted their family involved in their care planning. Okay. But despite that data, I think most of us would think that it's actually kind of inverted, right? We might feel like only 88% of us can be involved when a loved one is in a hospital. So at the last AOT symposium, we did a listening session with families. I helped facilitate this session along with Jerry Clark. And we did this because we were trying to glean out information from them about what they wanted providers, judges, lawyers, everybody to know from the family's point of view. And families want to collaborate and they want to especially be able to share the health history of their loved one. That's so critical because we know that more than any other provider. And families can affirm that while the data is accurate when showing improved outcomes, with family involvement. When we're involved, we know our loved ones are doing better. And we also want to stop the blaming of families for diseases that aren't the family's fault. We want to be able to remind providers that these are biological, in many cases, genetic illnesses and not caused by us. And we want to be able to partner with the system to prevent the crisis and not be forced to watch and wait for crisis in order for the system to respond to our loved one's illness, right? We're the ones that are the most invested. And in most cases, we're also the ones that are there and witnessing the effects of is a medication helping? Is it not? Are they having side effects? Are they deteriorating? We know the most about our own loved ones, and we want to be able to have a communication and intervene before somebody becomes a danger to themselves or others, right? And yet, we face barriers from all directions, including from our loved ones who often resist our help, right? Because they're paranoid about us. And that's exactly tied to the illness itself. Most often, people are going to have a lot of paranoia about their loved ones, and especially anybody that they're living with or in close contact with. And that's what's causing them to not want families involved, not their basic personality, right? And we also like to try to make sure that providers understand that the mental illness brought dysfunction to our family, not the other way around, right? Family dysfunction usually doesn't cause a severe mental illness like schizophrenia. Okay. And so, as we were doing this listening session, we had this wonderful graphic artist. Her name was Erica Boda, and she was online listening, and she made this graphic of all the conversation that covered a lot more topics than what we just did now. If you're interested and want to read a handout, a downloadable two-pager we created, I encourage that. It's a great thing to share with providers. I also had written, after the listening session, about a week or two afterwards, when we got home, I sat down and wrote a document. It was like a stream of consciousness document about all the things that were discussed during this listening session. And then Jerry, being somebody with a journalism degree, one of my colleagues, helped clean it up and make it better. And that was the initial blog that was posted and shared. And if anybody wants a copy of that, you can email me and ask me for that, because it's a very cathartic but helpful document. And I've had people involved with AOT programs, providers, write to me and tell me, I post this on my office wall, and I read this every so often to remind me that families are not the bad guys, right? And to be sure to be engaging with families to try to get more help around a loved one. Okay, we're going to move into, does SMI cause violence? And we touched on this briefly earlier. And it is important to kind of point out that most individuals with SMI are not dangerous. And most violent crimes are not even committed by individuals who have SMI, right? There's a whole lot of other people in the world that do a lot of violent crimes. But we also know that those who are engaged in treatment and treated for their symptoms are not aggressive. They're not the ones that are committing most of the violence. But people with untreated or undertreated SMI sometimes do have more aggressive behaviors, and they sometimes do have more violent behaviors as well. Most of that's directed towards themselves. About 2/3 of all the violence is suicide. And that's especially true with gun violence. 2/3 of all gun violence are suicides by gun, just so people know that. And violence is also sometimes directed towards caregivers or family, right? It's moms who are the number one target, then dads, siblings, grandparents, right? This is a fact, not because we're bad people, but because we're the ones close by and who most often have delusions about us. And that's an important data point there for the NIMBYism. Most of the time, somebody who is untreated for an SMI, they're not going to come next door and hurt somebody else. They're going to hurt us. Okay. And keeping them in treatment and having housing for them and supportive housing helps to limit that violence and improve public safety. Okay. So now we're going to talk about HIPAA, the Health Insurance Portability and Accountability Act. Okay. It was created to protect sensitive health information and records. It required providers to keep medical information confidential unless sharing with other providers, or to ensure continuity of care, or with caregivers to ensure patient well-being and safety. That was its purpose, okay? So, does HIPAA allow a healthcare provider to communicate with the patient's family, friends, or other persons involved in the care? The answer is yes. It absolutely does allow that per the letter of the law. In recognition of the integral role that family and friends play in a patient's healthcare, the HIPAA privacy rule allows these routine and often critical communications between healthcare providers and these persons. Now, sometimes we have to print this stuff out and share it with providers to ensure that they will communicate with us. There's information about this right up on the Department of Health and Human Services website. And TAC, we also, in our resource center, we also have a whole section dedicated to HIPAA where you can go and print it out if you want to. So, what if there is no release of information? If the patient is not present or is incapacitated, may a health care provider still share patient's health information with family, friends, or others involved in the patient's care or payment for care? And again, the answer is actually yes. If the patient is not present or incapacitated, they can do that as long as the healthcare provider determines, based upon their professional judgment, that it's in the best interest of the patient. So that is absolutely possible. And Margaret, I see your hand raised, but I'm going to have you wait till the end just so we can kind of get through the material, if that's okay. HIPAA can also protect families too. I don't know if you've ever been in a situation of a provider forcing you to provide them information in front of your loved one. If that starts to happen to you and it's going to possibly damage your relationship or put you at risk, you can tell them, I don't feel comfortable talking about this here. I would like to have a private conversation with you. Okay. They always need to, and you can always provide information to them, even without a signed release of information form, right? And they do not have to tell the patients that you're the one that provided them with the information. They will often say, I'm going to have to say, your mom told me, blah, 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 blah. The problem is that puts us at risk, right? If we're the ones that have to say, my son was threatening to kill me with a knife, right? Nobody wants to say that and know that their loved one's going to hear it because it puts us at risk for them feeling like we locked them up, okay? When what we're really trying to do is get them treatment. So it's really important. You sometimes have to educate the providers that this is true too. They do not have to disclose that we're the ones telling them. So why does HIPAA keep getting in the way? Because this is the law, but we all know that we have people putting up hands and saying, no, we can't talk to you. Well, it isn't the law. It is the misunderstanding on the part of the hospitals and the providers misinterpreting the law and to some extent using it as a barrier so they don't have to deal with us, right? It's a lot easier to go ahead and provide incomplete care to a patient in the hospital and discharge them if they've never talked to the family, right? If they never have any accountability in terms of us being able to say, this person isn't safe in our home, please don't send them back here, right? It's a matter of providing a whole lot of education to all the providers and people in the system to understand what the HIPAA laws actually say. And a good example to give to them is if I were bringing in my mom with Alzheimer's, you would be considered negligent if you didn't talk to me about how I can best help my mom when I bring her home. We need to demand that same kind of thing to them that my son is not well. He doesn't understand his discharge instructions. You have a responsibility, a professional responsibility to engage with me in the care so I can understand and best support my loved one. Okay. And it's up to, unfortunately, it's incumbent upon us to be the ones to educate them. So if you can get yourself invited to be a speaker at professional conferences when your psychiatry association's meeting in your state or your nurses or your social workers, anywhere you can get to provide this type of education, I encourage you to try to do that or one by one as you need to for the care of your loved one.